Good morning. Our success in ramping up vaccinations in St. Louis County continues. This week, our Department of Health is on schedule to administer more than 18,000 vaccinations, the highest one-week total that we have achieved so far in the pandemic. As more vaccine becomes available, we look forward to a new one-week goal. We offer vaccinations in a variety of settings to remove barriers and make it convenient or as convenient as possible for our residents, and especially our most vulnerable. We are partnering with fire districts to reach residents of senior homes as well as homebound, and we are finalizing plans to vaccinate our unhoused individuals through a partnership with our Department of Human Services and other partners in the community. We are also happy to offer 2 mass vaccination events this week. Our first is tomorrow, Thursday, at Queeny Park, and that site proved to be a successful one for us last week when nearly 4,500 people received a vaccine dose over 2 days. Tomorrow we intend to administer another 2,340 doses. Then on Saturday we will conduct our first South County mass vaccination event at South Technical High School at 12721 West Watson Road, where we are set to administer another 2,340 doses. Both events are coordinated with the Department of Public Health with assistance from the Missouri National Guard, and the hours of both events will be from 9 a.m. to 6 p.m. As always, these events are only available to people with a specific appointment. To get on our list for an appointment, please register at stlcorona.com. You can also register for a vaccine with the state at covidvaccine.mo.gov or with local hospitals and pharmacies through their websites. These and other vaccination efforts bring hope, but it's important to keep in mind that we are still in a pandemic. Numbers of new cases have begun to rise in several places across the country, sparking warnings from federal health authorities. Let's make sure that that doesn't happen in St. Louis County. Please remember to wear your mask in public, avoid crowds, and keep your distance from others and wash your hands. And of course, get a vaccine when it's your turn to do so. I'd like to end with a quick update on the $192 million St. Louis County is expected to receive from President Biden's American Rescue Plan. I've met one-on-one with council members to discuss their priorities for how the county should spend these funds, and I look forward to these conversations continuing, especially as we get more guidance from the federal government on how we can use these badly needed funds for our community. On Friday, I wrote to Treasury Secretary Janet Yellen asking her department to provide timely, consistent, and clear guidance on the use of ARPA funds. ARPA limits expenditure of these funds to certain authorized uses, including spending those funds to respond to the COVID-19 pandemic or its negative consequences, to pay essential employees premium pay for working during the pandemic, to compensate for the county's reduced revenue due to the pandemic, and to invest in water, sewer, broadband, and other infrastructure. There are many important priorities, from public safety and crime reduction to infrastructure improvement and workforce development, in which we would like to consider investing ARPA funds, but we need more guidance from the federal government first. Our experience with the prior administration concerning CARES Act funds received last year left much to be desired. The Treasury Department issued guidance on how the CARES Act funds could be used, but that guidance was initially vague, then modified about half a dozen times throughout 2020. We look forward to the guidance for these new funds so that once they are received, we can spend these funds properly and wisely. As I mentioned in a letter to the council members last week, these new funds present tremendous opportunities accompanied by the significant responsibility of spending them wisely. We are entering a new phase of this pandemic, and we hope this new phase will be less emergent, allowing us to think more long-term and more big picture. We will still need to invest in public health resources and humanitarian aid, but this new phase will also involve getting people back to work, fully reopening, and growing our economy for the future. If we maximize the impact of the ARPA funds, the St. Louis County of the future will be much stronger, more dynamic, and more equitable. I look forward to working collaboratively with the council to identify the best ways to achieve these goals, and I'm happy to take any questions.
Dr. Page, we don't have any questions this morning.
Okay, Thank you.